the hashtag NerveLocks. It's all over my socials. It's what I talk about all the time in the human body and in athletes now. NerveLocks. What is it, Jim? Don't really understand. I've seen your videos. How does it compare to acupuncture or dry needling, which is very well known now, especially here in Australia? Dry needling for trigger points. It's out there. It's been doing it now nearly 20 years. Solidly in the Western world, dry needling for trigger points. So what's the difference? Simply, NerveLocks are nerves that are locked in the body. NerveLocks are the central processing system of our body, the spine, the brain, shoots out all the nerves to every part of our body where there's access, and the nerves protect. It guards and protects areas or an area specific to your problem, your dysfunction, your pain, that's chronic especially. It's protecting. And the reason why it protects is because it sensed some type of trauma, whether it's a major one, a really bad one, repetitive. Athletes, let's talk about pitchers, constantly pitching, right? Constantly pitching. Let's talk about rugby players, NFL players, fighters who constantly get hit, always get pain, trauma, but it's repetitive. NBA players who constantly do jumping, shooting, running, jumping, shooting, turning. How many games do they play a week? And how long's the season? Really, it's the team or the players that survive and are in okay shape at the end of the season, war of attrition. They're the ones who generally play well to win. NerveLocks are all in this space here. So it's the way the body protects an area from further harm. So let's talk about an athlete, for example. If they're constantly bashing themselves up, whether it's contact or non-contact, it doesn't matter, week after week after week, training, volume, the nervous system goes, right, I just need to preserve and protect this area a bit. So they always carry these niggles, they carry these tightness, they get all the work done on them every day. You know, they're in a professional team, they get massage, they get acupuncture, they get dry needling for trigger points, they get all the best exercises, and yet it feels good for a little bit, and then it's still kind of there. Something is still there holding me back. I feel a little vulnerable. I always think about it. It's always at the back of my mind. You're right. There's always that little doubt and worry. NerveLocks. Let's talk about people in chronic pain. Chronic pain literally to me means emotional pain. The emotions of the body. NerveLocks are completely involved in this. I say to everyone, NerveLocks, 80 to 90% emotional, because when you think about it, simply, if a pain or a problem has been with you for over 2 weeks, 2 months, 2 years, can you imagine what it does to your emotional system, your emotional brain, your hormones, right? Your stressed nervous system, your sympathetic nervous system, your parasympathetic nervous system. What does it do? Worrying about it all the time, feeling it all the time. It's depressing you. It's limiting you. You can't do what you want to do. You don't feel like doing something that you love to do. You don't feel you're capable of doing that you're gifted to do because of that pain. I'm in bed all the time. I'm completely deconditioned. I used to be an athlete. I used to be able to run like this, and now I'm not. Emotionally, this is very, very negative, depressing. It causes anxiety, a lot of worry, a lot of nervousness, a lot of vulnerability, a lot of uncertainty and hopelessness. So NerveLocks are in this space as well. It's all about the way the nervous system is protecting the body from further harm. So what the needle treatment that I designed, which is very different to acupuncture, it's very different to the dry needling for trigger points needling, or the needle itself. It's slightly thicker, but I go directly to the nerves that are locked. They're in different points. It's a different treatment method altogether. It's a very different prognosis altogether, which means what happens after I release everything. It's all a new paradigm. It's a new concept that I came up with in early 2000s, and I've been testing and testing and testing over and over again. Over 70,000 cases now that I've gone through personally, asking questions after questions. In those days, it was calling. I was calling everyone, always checking in. What happened 2 weeks, 2 months, 2 years later? What happened? Tell me the truth. I don't care if you tell me that I sucked. I'm just a great guy, but what you're doing to me is not really working. And this is what I was hearing a lot in my early days as a practitioner. Really big hit to the ego. But I kept persisting. Emails then came out, kept checking in. What happened? So therefore my patients, all the people that I had the privilege of working with, they were my textbook, understanding the anatomy. Had to go back to the anatomy and physiology again. What was I feeling under my fingers that was different to what the medical textbooks and papers were telling me and educating me on about trigger points, Chinese meridian chi points, right? All different. What is that? That is not in the textbook. So I kept experimenting. I tried, I released, changed the needle a few times, and then I found the Holy Grail, and there it was. I designed a treatment, established it for NerveLocks. Nerves that lock. I kept it really simple. And these NerveLocks are the reasons why people suffer pain that are going too long. Problems that just don't seem to want to get better no matter what I'm doing, no matter all the best exercises that I'm doing, from the best to the best. Don't get me wrong, no disrespect to anybody else here. It's just the way the body works. I've observed this over thousands of people now. It's just the truth. When the body is saying stop, no. The amazing author Gabor Mate, loved his book. I related to it completely. When the body says no, Gabor Mate, what a legend. It's real. NerveLocks are in that category as well. The NerveLocks are stopping the human body from progressing forward. And that's why the people that I always meet here, especially here in my practice, Jim, I get this worked on all the time. My traps, for example, for all the chronic headaches and migraines that I get, I always do everything for this area. I massage it. I get trigger point needling. I get acupuncture. I get deep tissue massage. I do all the best exercise for my traps and my scapular muscles, for my thoracic spine, all alignment issues. I try to do all that. I change my shoes. I put orthotics in. I get my leg length corrected. I do everything below and above biomechanically to make everything beautiful, but it's still there. Normally what used to happen was when I go and see my chiro, my osteo, my physio, my guru, and they do their thing, it goes away. I'm temporarily good for a while, and then bam, it's back again. What the? Why is that? Right? I had a patient today. I've been doing this for so long, always getting into it myself. I just want to get somebody to get right into that point that nobody seems to be able to get to, even with the needling that I've had done. I want to get my finger deep in there and get it, but I just can't seem to get it. That's a NerveLock, and that's what my needle goes directly towards and unlocks. It's what my patients always say. It's the most common, most popular response. Once the NerveLocks are reset or unlocked, as I say, this is when a whole new world opens up for the person who's been suffering. I tell everyone, once it unlocks your muscles, especially your traps, for example, let's use this one for the chronic neck pain, headaches, migraines that people suffer from 2 years to 25 years. This old habit in the muscle changes because the nervous system finally reconnects with the brain again. And then I give you this opportunity to actually get this upper trap or both traps to wake up again and build the endurance it needs. For example, I'm not a marathon runner. If I decided to go and run a marathon tomorrow, I will be in hospital with something. My muscles and my body would be in a lot of trouble. But if I trained my muscles gently and slowly and smart for the next 6 to 8 months, I will be able to tolerate a marathon, no problems. It's the same with the upper traps. If you've been suffering, for this specific example, upper trap headaches, migraines repetitively with all your habits every day, hormonally as well for the ladies, this upper trap has been switched off. You've been told this all the time by your practitioners and specialists and so forth, right? Everything else otherwise is beautiful. I've had multiple MRIs, as this gentleman said today. Everything is beautiful, but it's still there, giving me hell every day. Your traps are switched off. Your glutes are switched off. You've always heard that one. How many ladies out there know or have been told your glutes are asleep? But no matter how much I try to reactivate, exercise, build them back up, nothing happens. It goes back to the same, and the pain is always there. There's the key. The pain is always there. The pain is always there. Once the NerveLocks are released, it gives you that opportunity. Your brain reconnects with it, and away we go. You have now that time to train. And that training, the amazing exercises you're doing for every areas will actually start to work. And this is why I get so many comments coming back at me saying, wow, I can actually feel everything. It's starting to stabilize. This is incredible. This is what NerveLocks do. This is what NerveLocks do. So when people come to my practice, I give them certainty and direction on which one to go down. You are here, this is what's going to happen. Or if it's not happening, you've got this problem. Remember, the NerveLocks are protecting something. They're protecting something. So when that protection mechanism is now reset and unlocked, what happens? Everything comes back to normal. Whatever it was protecting has been healed, because that was a problem 15 years ago. It's healed, but your body was protecting it and preserving it emotionally and physically for that long. Or you actually have that problem. You actually have a true bursitis in the hip or in the shoulder. It is inflamed and raw, and it needs to be injected with a cortisone injection. You definitely need that knee replacement. You definitely need that surgery for your knee, your hip, your shoulder, your lumbar spine, your cervical spine. It gives you certainty in what direction you need to go down, because the NerveLocks have been released. NerveLocks, everyone, it's protecting your body. Athletes, watch this space again. It's going to change your world. It's going to change your game, because when NerveLocks disappear in your body or reset, all that training, all that dysfunction and pain that you've suffered in your life from traumas, from your sport, emotionally and physically, it all unlocks, and it brings forward your superpower. All your abilities in your nervous system connected. It all comes to fruition. It all comes out, and it gives you this incredible body to be able to perform better, but prevent injuries, stop injuries, especially soft tissue muscle tears from coming on as well. Watch the space. I don't want to get into that in this video. I hope this helped answer a lot of your questions, everyone. I apologize, it's a long one, but it is a question that I always get, so I thought I'd do a nice video to help explain. Any questions, comment below. I'll do my best to get back to you. Until the next time, take care, everyone. I'll talk to you all again soon.